Happy New Year, class. This week we're gonna talk about three topics about erectile dysfunction, osteoporosis, and obesity. I'm gonna record two separate short segments for each one of them. So this is the first one on erectile dysfunction. Erectile dysfunction is the inability to maintain penile erection for the successful performance of sexual activity. ED has many physical and psychological causes, including vascular disease, diabetes, medications, depression, and sequelae to prosthetic surgery. It is estimated to affect more than 30 million men in the United States. Previous therapy have included penile implants, intrapenile injection of alprostadil, and intraurethral suppositories of alprostadil, that's another Sexual stimulation results in smooth muscle relaxation of the corpus cavernosum, increasing the inflow of blood. The mediator of this response is nitric oxide, NO. Nitric oxide activates guanylyl cyclase, which forms cyclic guanosine monophosphate, cyclic GMP from guanosine triphosphate. Cyclic GMP produces a smooth muscle relaxation through a reduction in the intracellular calcium concentration. The duration of the action of cyclic nucleotides is controlled by action of phosphodiesterase. At least 11 isoforms of phosphodiesterase have been characterized. Current treatment for ED. So the drug are the phosphodiesterase 5 inhibitors, sildenafil, which is Viagra, vardenafil, Cialis, and tadalafil, which is Cialis, the vardenafil, which is Levitra. All three PDE5 inhibitors are equally effective in treating ED, and the adverse effect profiles of the drug are similar. However, the duration of action of PDE5 inhibitors differ, as do the effects of food on the rates of drug absorption. Viagra and Levitra and Cialis inhibit the phosphodiesterase 5, the isoform responsible for degradation of cyclic GMP in the corpus cavernosum. The action of PDE5 inhibitor is to increase the blood flow into the corpus cavernosum at any given level of sexual stimulation. At recommended doses, PDE5 inhibitors have no effect in the absence of sexual stimulation. So you still need to have sexual stimulation for the drug to be working. Sildenafil and vardenafil have similar pharmacokinetic properties. Both drugs should be taken approximately 1 hour prior to anticipated sexual activity, with erectile enhancement observed up to 4 hours after administration. In contrast, tadalafil has a slower onset of action than sildenafil and vardenafil, but a significantly longer half-life of approximately 18 hours. This results in enhanced erectile function for up to 36 hours. The timing of sexual activity is less critical for tadalafil, which is Levitra, because of its prolonged duration of action. The most frequent adverse effects reported for PD inhibitor are headache, flushing, dyspepsia, and nasal congestion. These effects are generally mild, and men with erectile dysfunction rarely discontinue treatment because of side effects. Disturbances of color vision, loss of blue-green discrimination occur with sildenafil, probably because inhibition of phosphodiesterase type 6, which is a PDE phosphodiesterase found in the retina that is important in color vision. Some caution to keep in mind, because there is an inherent cardiac risk associated with sexual activity. PDE5 inhibitor should be used with caution in patients with a history of cardiovascular disease or those with strong risk for cardiovascular disease. PDE5 inhibitor should not be used more than once per day because of the ability of PDE5 to potentiate the hypotensive activity of nitric oxide. Administration of these agents in patients taking any form of organic nitrate, for example nitroglycerin product, isosorbide dinitrate, or mononitrate, is contraindicated. PDE5 inhibitor may produce additive blood pressure lowering effect when used in patients taking alpha-adrenergic antagonists as used to treat hypertension or to alleviate symptoms associated with a benign prostatic hyperplasia.